I think my Spanish is still too bad, so I have to continue in English. It's a great pleasure and honor to be here, and from the CIOMS, Council for International Organizations of Medical Sciences, it's really my pleasure to be in this very special occasion here, because we launched 2 years ago the working group about the clinical research in resource-limited settings. The whole mission of CIOMS, Council for International Organizations of Medical Sciences, is to try to improve the public health by issuing guidance documents. And this guidance document, I think, is extremely important for the very simple reason, because the populations in resource-limited settings, disadvantaged settings and disadvantaged population, they can't benefit from the modern healthcare and the innovation without clinical research. So the clinical research is the tool through which we can improve the public health, that we can improve the health of populations also in resource-limited settings, also the populations who are in one or another way disadvantaged. Now, to do that, of course, there is a lot of things that have been going well in the world, and we can make the progress, but also we can see that there are also obstacles for doing the clinical research in resource-limited settings. And our working group tries to look on the challenges and opportunities of the clinical research in these settings. And of course, with every working group, you have one limited trouble. You can't involve everybody in your working group. So this is what we are also trying to benefit today, during these days here, is that we can try to combine our efforts to listen the voices from Latin America, from indigenous populations, to try to benefit and give input to our group, that we could try to build on that and have our guidance, which hopefully would facilitate the good quality clinical research in resource-limited settings. So we are extremely excited, and we are extremely grateful for the governments of Extremadura, the Mérida city, the Extremadura University, and also to the member of our working group, Professor Adrián Lerena, who was initiating this idea, and we discussed how we could make the more links between the various initiatives, how we could benefit from the work done also here with the support of the Extremadura government in Latin America, and how we could benefit these networks that Professor Lerena has built during the years. And I think in the public health, in the end, I would say there is one little problem. If you work in the public health, you can always do better. If you work in some other areas, you can be more calm. You can go to sleep, you have done well. But in public health, you can always do better. No matter how good you are, you can always do better. I don't know any hospital who can't do better. I don't know any medical practitioner who can't do better. I don't know any society who can't do better in terms of public health. So we all have the obligation, and we have to have the commitment to work for the public health, and I think it's extremely rewarding to see that in this environment in Spain, the governance of the Extremadura is also investing in developing public health, not only in their own region, which I know is also ongoing, but also beyond, and trying to help some of the populations who may not yet benefit fully from the clinical research. Thank you very much.